Systems, you've probably heard of them. If you haven't, then your medical records are probably under HITECH Systems. This is a company that wanted to digitize all the healthcare records, and it mostly looked at hospitals. It was incorporated in 1979, but the big boom, they say, came really in 2009. It's a $4.5 billion company. What were they doing from 1979 to 2009? And what was the big thing that happened in 2009? HITECH Systems was earlier called Human Services Computing. But then in 1979, they decided that they would be Epic. Judy Faulkner, their CEO, had a vision. She wanted to computerize and digitize all the healthcare records in hospitals and eliminate paper. There were sheets of paper flying around, thick files and folders moving around, and two people couldn't access the same folder at the same time. So there came computers and softwares wanting to make it easier for everybody. As I said, they're a $4.5 billion industry, and now they employ tons and tons of people. Probably over 4,000 employees, maybe more. So in 2009, there came an act called the HITECH Act. It basically meant that Medicare and Medicaid services in the US were demanding that the hospitals send their billing and their paperwork in a digitized fashion. This was a big deal. Earlier, everything was being done on paper and manually. We did not have electronic systems in place. It was a big deal for hospitals because they wanted to make sure that the patient billing and reimbursement and all the insurance processing is happening quickly enough and at the right time. So when there was a mandate by the government, they had to do it. Epic was incorporated in 1979. So till 2009, were they doing nothing? Not at all. There was plenty to be done. After being incorporated in 1979, in 1985 is when Epic made its first million in revenue. In sales, they made 1 million, and at that point, they had 29 employees. During this first 5 to 6 year period, they were focusing on scheduling. When patients come in, what's the appointment like? Do the physicians know their schedules? How many patients could be seen in a day? Could we see more so that patients could be accommodated and did not have to be turned away? That was really how it all started. And the breakthrough, as I said, the first million happened in 1985. By the year 1990, Epic started doing inpatient, so there was an inpatient module where you could admit patients. It started doing billing, so you could submit billing to the hospital billing when patient was admitted, discharged, room rent, the laboratory tests run, and all those things that benefited the hospital. Around the 2000s came the famous Hyperspace. Hyperspace basically meant that all the physicians, nurses, physical therapists, caregivers could double-click on an icon and a nice drop-down menu-friendly, user-friendly thing popped up onto their screen. It had nice user interfaces, which was very unlike what the hospital was used to, because the hospital was used to dark screens and things they had to type out and had difficulty in understanding prompts and what is to be entered and what is not. Epic really tried to make it user-friendly and tried to replace all those dark horrendous screens so that better things could be done in the hospital. In 2002, we had a breakthrough. We had something called MyChart. It basically meant that it was a system, a portal, and a login for the patients, where the patients could log in and see their history. They could see their medications. They could schedule appointments. They could see what had happened in the past and what they wanted to plan for the future. It gave power back to the patients, and they could access things online and do things online. Epic CEO Judy Faulkner started Epic with a $70,000 investment. Sounds like a lot? Well, in 1979, it was not a small amount, but it wasn't a big amount either. They've lasted about 40 years. Amazing things have been done. There's still a lot to be done because they're coming up with AI in healthcare and other things, other IP intellectual things, which makes healthcare providers have an easier time seeing patients and understanding all the data that is available. Epic by itself has tons and tons of employees, but there are many hospitals all over the world, specifically in US, UK, Netherlands, where analysts and other folks are working within an Epic hospital. And nowadays it's amazing, even while hiring clinical folks like physicians, like nurses, hospitals actually say if you've worked on the Epic system before, you will be preferred for this role. Amazing things have happened in the last 40 years, but this epic journey really marks perseverance.